First questions that most women ask us is what happens at an antenatal checkup. We usually start the visits by answering any questions you may have and looking over any lab reports and just spending some time getting to know you. Then we move on to the physical exam, which generally consists of checking your weight, measuring your uterus to ensure the baby's growing at a normal rate, listening to the baby's heartbeat, checking your blood pressure, and then checking your urine for glucose and protein that might let us know if you're at risk for preeclampsia or gestational diabetes. By far the most important part of antenatal care is the time we spend talking. So most antenatal checkups last anywhere from 20 minutes to an hour, depending on how many questions you have or if there's anything going on in your life that you need to talk about. This time spent getting to know one another is important because when it comes time for the birth, there are no strangers. We know you as well as you know us. So we know what things might come up during the birth, where you might need some extra support, and what we can do to help you with that. So really, as midwives, we see that time spent getting to know you as important, even more important than the physical exam. We like to spend ample time answering your questions and talking about any concerns you have so that when you leave an antenatal checkup, you feel comfortable and confident that you are healthy, that your baby is healthy, and that gives you a very strong base and support to have a really good birth because you're not walking around with all these fears and unknown questions. When prenatal visits are very short, and for some care providers it's as short as 3 or 4 minutes, you don't have time to ask your questions, get to know your care provider, or talk about the things that you may be afraid of. Perhaps you think your baby's too large and you don't think that baby will be able to be birthed naturally, or maybe you just have no clue what to expect for the birth. So we like to spend all this time preparing you for what may happen during the birth as a supplement to Lamaze classes so that you know what to expect and how to best help yourself and how for your partner to help support you during the birth. So often husbands, mothers, fathers, sisters sometimes come with women to their antenatal checkups. We think it's a time for the whole family. Women who have other children often bring children along because birth is a family event. It's not something that just happens to a woman. This entire family is welcoming a baby, so they should be as involved in the care as the woman is.